In here, in our next pharmacology question, we'll be looking at the adverse effects when you actually administer some thrombin inhibitors parentally, parenterally. Okay, so you know what thrombin is from the blood coagulation pathway. Okay, thrombin is that thing that will actually be formed from prothrombin. The thrombin will act on circulating fibrinogen to convert it into fibrin. Okay, then the fibrin mesh. So thrombin is like promoting blood coagulation. Then thrombin inhibitors will be like anticoagulant. They will be preventing what blood coagulation. Okay, so moving, we'll be looking at the adverse effect. An adverse effect is basically like, okay, if you administer these antithrombin drugs or thrombin inhibitor drugs in excess, that's basically there's a toxicity of these drugs. Okay, so if there's a toxicity of these drugs, what will be the adverse effect? Okay, so the examination question was like this: highlight the major adverse effect associated with what parenterally administered thrombin inhibitors, right? Or they could say antithrombin. It's still the same thing. Basically, drugs that are opposing the action of thrombin. So you could see this is like, let me say this is a site where these antithrombin drugs can basically come to bind, okay, and try to like inhibit thrombin. So first of all, let's define it. Thrombin inhibitors are anticoagulant that bind to and inhibit the activity of thrombin, therefore preventing blood clot formation or blood coagulation. Okay, so thrombin inhibitors, they inhibit free thrombin and also the thrombin that is bound to fibrin. Okay, so thrombin that is already bound to fibrin, they will inhibit it, and the free thrombin that is in circulation, they will still inhibit it. Okay, so thrombin inhibitors are used to prevent arterial and venous thrombosis. This is when, okay, you don't really need blood to coagulate in blood vessels, but blood is coagulating. That's why we call it thrombosis. Okay, so now if you want to actually prevent this thrombosis, that's where they are what therapeutically useful. Okay, so we use them to actually prevent this thrombosis in arteries and veins. Okay, so this is how anticoagulants work. Okay, so you see some can be inhibiting the activation of factor 10 to the active factor 10, and some can be inhibiting the thrombin, and these are the ones that we are looking at. That's a thrombin inhibitor. Okay, so I think we have two types of thrombin inhibitors. We have the direct thrombin inhibitors, and we have the what indirect thrombin inhibitors, right? So let's briefly look at the direct inhibitors now. We said that direct acting thrombin inhibitors inactivate thrombin in an antithrombin dependent fashion. Okay, so examples of these direct acting thrombin inhibitors include what? Hirudin, bivalirudin, then argatroban. Okay, these are the drugs that can basically what inhibit thrombin directly. And we'll be looking at the we'll be looking at the indirect thrombin inhibitors, right? So, for example, we have heparin, we have what fondaparinux, we have the idraparinox, we have the what danaparinoid. Okay, so we'll be looking at these first two because they are the most common ones that we use in the hospital. Okay, so we'll be looking at their adverse effects. So what is the adverse effect of heparin? Okay, heparin is useful. It will help you prevent coagulation or blood clot formation in the blood vessels. Okay, but there are some adverse effects like, okay, if there's a toxicity of heparin and all that. Okay, so bleeding, there could be what uncontrolled bleeding. So since it is stopping bleeding, if it is in excess, then let me say, since it is stopping coagulation, if it is in excess, then there will be no bleeding at all, there will be no coagulation at all, therefore leading toward bleeding. Then there's heparin induced thrombocytopenia. We said that this is a systematic hypercoagulable state occurring in 1 to 4% of patients on unfractionated heparin for a minimum of 7 days, usually 5 to 14 days, or earlier if heparin was given less than 3 months. This is just to tell you guys that if there are different types of heparin, two types. There's the low molecular weighted heparin, which is the best one, and there's the unfractionated heparin. All right. So now the unfractionated heparin, sometimes it can stop working. All right. That's why you say that it was preventing coagulation for some time. Okay. So it was preventing coagulation for some time, but it doesn't actually act for a long time. Okay. So it can result to this heparin-induced thrombocytopenia. And this thrombocytopenia is basically like reduced levels of platelets in the body. Okay, so moving forward now, I see what the direct acting, the direct ones now, all those hirudin, bivalirudin, and the rest of them, right? That we saw here. Okay, so moving to the next one, it can also induce osteoporosis. That's basically soft bones. Okay. Now, there's also modest elevation of transaminase. Okay, without concomitant increase in serum bilirubin level. Okay, so there's elevation of transaminase. Okay, when you are actually using heparin for treatment. Okay, then also the next indirect acting thrombin inhibitor, we have fondaparinux, and the main adverse effect of fondaparinux is bleeding. Okay, so fondaparinux is an antithrombin, so it is anticoagulant. It is preventing blood coagulation. So now if you have fondaparinux toxicity, that means it will now be stopping, how will I put it? It will now be stopping coagulation too much, okay? And this will result to excessive bleeding, okay? So if you are using fondaparinux for treatment, it can also result to bleeding, okay? So that's it about the adverse effects of adverse effect associated with parenterally administered thrombin inhibitors. So these thrombin inhibitors, uh, parenterally, what does parenterally means? Okay, parenterally means that they are administered through other routes other than the oral route. Okay, so parenterally means that maybe it was intravenous. Okay, so these are basically the adverse effects. Okay, so that's it, and bye.